Here's what every parent in Alabama needs to know right now. A disease that medical experts thought was virtually extinct in our state has just made its terrifying comeback. On Monday, Alabama's Department of Public Health delivered news that sent shockwaves through the medical community. The state's first confirmed measles case in over 2 decades. The victim? A young child under the age of 5 living in northern Alabama, whose story reveals a troubling trend that's spreading across the entire nation. But here's where it gets controversial. This child was completely unvaccinated. According to state health officials, the youngster contracted this highly contagious disease while traveling internationally with their family. Fortunately, the child wasn't enrolled in daycare or school, which potentially prevented what could have become a devastating outbreak. However, this incident has reignited heated debates about vaccination choices that are dividing communities nationwide. Interestingly, the affected child's siblings tell a completely different story. They received their vaccinations and remain completely symptom-free, even after being in close contact with their infected sibling. This real-world example perfectly illustrates the stark contrast between vaccinated and unvaccinated outcomes. But will it change anyone's mind? Dr. Karen Landers, who serves as the Chief Medical Officer for Alabama's Department of Public Health, isn't mincing words. She's urging every parent across the state to immediately verify their children's vaccination status. Make absolutely certain your kids are current with their measles immunizations, Landers emphasized. And the statistics backing her plea are genuinely frightening. Here's the number that should keep every parent awake at night. Infected people become walking time bombs, capable of spreading this dangerous disease to countless others before they even realize they're sick. And this is the part most people miss. Alabama's situation mirrors a disturbing national pattern that's been building for years. The Centers for Disease Control and Prevention officially declared measles eliminated from American soil back in 2000, thanks to exceptionally high vaccination rates that created what scientists call herd immunity. It was considered one of modern medicine's greatest triumphs. But that victory is rapidly crumbling before our eyes. Nationwide, vaccination coverage among kindergarten students has plummeted below the critical 95% threshold that health experts say is absolutely necessary to prevent outbreaks. As vaccination rates continue their downward spiral, measles activity is exploding across the country in ways we haven't seen in generations. The harsh reality? America is currently experiencing its most devastating measles year in more than 3 decades. By August 20th of this year alone, the CDC had already documented 1,375 confirmed cases nationwide, a number that would have been unthinkable just a few years ago. This resurgence has caught many medical professionals completely off guard. Before a recent major outbreak in Texas, most physicians in that state had never encountered a single measles patient during their entire careers. The disease had become so rare that many doctors were seeing it for the very first time, despite years of medical training. Texas Department of State Health Services Commissioner Jennifer Shuford highlighted this shocking reality, explaining how an entire generation of healthcare workers had been practicing medicine without ever witnessing this once common childhood disease. But what exactly makes measles so dangerous, and why are health officials so concerned? Measles represents far more than just another childhood illness. It's a serious respiratory condition caused by a virus that establishes itself in the nose and throat of infected individuals. The pathogen spreads with terrifying efficiency through airborne droplets released when someone coughs, sneezes, or even talks. Simply breathing the same air as an infected person can be enough to contract the disease. The infection follows a predictable, but dangerous pattern. Symptoms typically emerge between 7 to 14 days after initial exposure, beginning with what many parents might mistake for a common cold: fever, persistent cough, runny nose, and red, watery eyes. However, the telltale rash that follows clearly identifies this as something much more serious. Parents need to understand that infected children can begin spreading the virus up to 4 days before any symptoms appear, Dr. Landers explained. Those with compromised immune systems can remain contagious for even longer periods, making containment extremely challenging. This invisible transmission period makes measles particularly insidious. Infected children can unknowingly expose dozens of classmates, family members, and community members before anyone realizes there's a problem. So what's the solution, and how effective is it really? For the vast majority of children, protection comes through the MMR vaccine, which guards against measles, mumps, and rubella simultaneously. Some children receive the MMRV vaccine, which adds varicella chickenpox protection as well. The standard schedule calls for the first dose between 12 to 15 months of age, followed by a second dose when children reach 4 to 6 years old. For families planning international travel or living in outbreak areas, babies as young as 6 months can receive early vaccination for additional protection. This flexibility allows parents to safeguard their children even before the standard vaccination age. Here's what vaccine skeptics might find surprising. Alabama's Department of Public Health reports that the MMR vaccine demonstrates an impressive 99% effectiveness rate in preventing measles after the complete 2-dose series. These aren't pharmaceutical company claims. These are real-world results documented by independent health agencies. Parents can access these vaccines through their children's pediatricians or local county health departments, making protection readily available to virtually every family, regardless of their economic situation. But here's where the controversy really heats up. Is getting the vaccine actually safer than contracting the natural disease? Health officials unanimously insist that receiving the MMR vaccination carries significantly less risk than experiencing actual measles infection. However, this claim continues to face challenges from parents who question vaccine safety or prefer natural immunity approaches. The medical establishment warns that measles can trigger serious complications extending far beyond the initial illness. Potential consequences include painful ear infections, life-threatening pneumonia, and encephalitis, a dangerous swelling of the brain that can cause permanent damage or death. Currently, no specific antiviral medications can cure measles once infection occurs. Treatment focuses entirely on managing symptoms through adequate hydration, plenty of rest, and non-aspirin fever reducers like acetaminophen or ibuprofen. Essentially, medical professionals can only help patients ride out the infection while hoping serious complications don't develop. Given these limitations, prevention through vaccination becomes even more critical. Alabama health officials are urging parents to contact their healthcare providers immediately if they suspect their child has been exposed to measles or is displaying suspicious symptoms. This advice becomes particularly urgent for families with infants, children taking immune-suppressing medications, those with tuberculosis or cancer, anyone with immune system disorders, or children who haven't completed their 2-dose vaccination series. As this Alabama case demonstrates, measles isn't just a problem somewhere else. It's a clear and present danger that can appear in any community where vaccination rates drop below critical levels. So here's the question that every parent needs to answer. In a world where preventable diseases are making dangerous comebacks, where do you stand on vaccination? Are you willing to trust decades of scientific research and real-world evidence? Or do you believe the risks of vaccination outweigh the proven benefits? The choice you make doesn't just affect your own family. It impacts every child in your community who might be too young for vaccination or medically unable to receive it. Your decision contributes to either protecting or endangering the most vulnerable members of society. What's your take on this vaccination controversy? Do you think parents should have the absolute right to refuse vaccines for their children, even when those decisions potentially endanger other people's kids? Or do you believe community health should take priority over individual choice? Share your thoughts, and let's have an honest conversation about one of today's most divisive parenting decisions.